According to the Pew Center for Research, 10,000 people are reaching the age of 65 each day. It's projected that will continue for the next 17 years as the baby boom generation ages. The increase in older boomers will dramatically affect the need for health care and the need for more nurses.
Amber Inman is a senior at the University of Oklahoma School of Nursing in Tulsa.
What's the verdict?
It was 164 over 84.
Not good. Not very good.
Well, we'll see if we can't get that down a little bit.
For the past 2 years, she has seen patients while training at this clinic. Inman graduates in May and has already secured a position as an intensive care nurse at a Tulsa hospital after doing a training rotation in ICU.
Sometimes it's life-changing to see someone just go through so much hardships, and then you go in the next week and they're sitting up and they're eating and you're like, wow, you feel so much better. I love it. And I love being a part of that.
Her enthusiasm is what nursing instructor Jamie Morris likes to hear, because the nursing occupation can be stressful, especially in a hospital setting.
Just dealing with 5, 6, 7, 8 patients and having all their medications given on time, seeing all your patients, doing your assessments, that is creating a lot of burnout for nurses.
Morris is well aware that the profession will have a great need for many new nurses in the coming years. The Bureau of Labor Statistics projects that in 2020, the number of practicing nurses will increase to 3.45 million, which is 26% more than today. That will make nursing the largest employment sector in the nation. The additional nurses are needed because the number of baby boomers aged 65 and older grows every year, and with age, healthcare demands rise. The Pew Center for Research estimates by the year 2030, 18% of Americans will be at least 65 years old. Tandy Groves is the Human Resources Coordinator for Hillcrest Healthcare Systems.
Our patient population is growing, so hospitals' census are going up. We've got more patients to take care of. We've got fewer and fewer nurses to take care of them. We've got a whole group of nurses that are going to either be retiring out of nursing or choosing maybe to take a different career path that isn't necessarily bedside nurses.
The average age of a registered nurse in Oklahoma is 47. Cindy Lyons is president of the Oklahoma Nursing Association. She's an OU nursing professor and a baby boomer.
Nursing educators are also a portion are aging, and we'll be looking for new nurse educators. And so we want to make sure that there's funding available for nurses to go on to receive that education so that they can become nurse educators.
We have instructor shortages because hospitals don't want to give their nurses to go become teachers, and teaching in general pays less than a lot of your bedside nursing positions, so it's kind of a cycle. So we're not graduating enough to fill our holes. We have a lot of holes, so we can't give up nurses to go be teachers to teach more to fill our holes.
The number of nurses with advanced degrees also needs to grow. Angela Dotson has a baccalaureate degree in nursing. She assists surgeons in the operating room and is trained in the new field of robotic surgery.
I'm definitely that type of person that I fix you up, I make you better, and I let you go back home and carry on with your life.
Devin Morris has a registered nursing degree and is studying to be a nurse practitioner.
What's really neat about nurse practitioners is that we work in a very interdisciplinary fashion with physicians, pharmacists, physician's assistants, and things like that.
Today, there are more nursing specialties than ever before.
In the metro area, you have nurses who are specialized in like wound care, or they work just the med-surg floor, or they have the IV teams.
Jamie Morris says there is also a need for nurses with a wide range of experience.
I see the rural areas needing nurses who are more generalized, who are more well-rounded, because at times I would be the only RN in a rural hospital, so I would work the ER, and hopefully that an LPN and an aide would work the floor.
Amber Inman lives near Grand Lake but will commute to work in Tulsa until she gets an advanced degree.
And there's not as much access to health care in the rural communities, so I'm also passionate about being able someday to get back to my own community by, going to nurse practitioner school.
The options for Inman and other nurses are many, and if projections are correct, it's an occupation that will ensure job security for the next several decades.